Today, we're diving into a really interesting topic that a lot of people wonder about: childhood OCD versus adult OCD. Is there actually a difference? Does it show up the same way in kids and adults? And what about treatment? Let's break it all down. So, you might be thinking, if a child and an adult have the same type of OCD, wouldn't they experience it the same way? Well, not exactly. The truth is, OCD can look pretty different depending on your age. Let's start with childhood OCD. For kids with OCD, the condition often shows up in ways that can be confused with typical childhood behavior. Kids with OCD might have intrusive thoughts, just like adults, but they often struggle to explain those thoughts. For example, a child might feel like something bad will happen to their family unless they wash their hands a certain number of times or arrange their toys just right. To them, it feels real, even if it doesn't make sense to others. They might get really upset if their routines are interrupted or if things feel wrong. And guess what? Parents or teachers might miss the signs because they don't recognize these behaviors as OCD. They might think it's just a phase or the child being extra picky. But no, there's more going on. Adult OCD. Now, let's talk about adults with OCD. Even though some adults may have had OCD since they were young, the symptoms often become more internalized as they get older. Adults usually know that their compulsions don't really make sense, but they still feel the need to act on them. Even when they understand that their thoughts are irrational or excessive, it doesn't make it easier to stop. In fact, many adults feel embarrassed or ashamed about their OCD and might try to hide it. For example, while a child might openly ask someone for reassurance, an adult could be more subtle, maybe mentally checking things, counting, or rereading emails to calm their anxiety. Life as an adult also comes with more complicated stressors, like work, relationships, or parenting, and these can make OCD harder to control. So, what about treatment? Is it the same for both kids and adults? Well, in many ways, yes. Cognitive behavioral therapy, CBT, and exposure and response prevention, ERP, are highly effective for both children and adults. However, with kids, therapy often involves parents or caregivers to help them manage symptoms. To sum it up, yes, there's a difference in how OCD looks in children versus adults, but the core symptoms are pretty similar. But whether you're a child or an adult, the good news is, help is available. And OCD can be managed with the right support and treatment. If you or someone you know is struggling with OCD, you can book a trial therapy session with us at OCDMantra. The link is in the description below.